Well, you hear the phrase, live your best life every so often. What does that mean for you? Well, for some of us, we live best when we feel best.
And physical therapy can be a big part of that. The team at Novacare Rehabilitation knows that. With locations in both Delaware and Maryland, they're committed to helping patients heal and doing so in the safest way possible. Here's Delmarva Life's Katie Zerilli.
Helping folks recover from injuries and regain comfortable, happy lives. Novacare Rehabilitation is a company that's been steadily growing here in the Delmarva Peninsula. And joining me via Zoom now are Kristen Phillips and Mark McDonald, both physical therapists at Novacare Rehabilitation. So tell me a little bit about Novacare and who you guys are.
We are a division of Select Medical. It is the largest physical therapy provider in the United States, and we are anxiously awaiting the opening of our newest center in Delmar, Delaware. The center will be open in September of this year.
And Novacare offers a lot of specialty services. You know, we're mostly probably known for our orthopedic rehabilitation, but we also do neurologic rehabilitation, hand therapy, instrument-assisted soft tissue mobilization, Parkinson's work with LSBT Big, dry needling. The selective functional movement assessment is another kind of feather in our caps.
Are you guys taking patients into the office right now, or how's it going?
Yes, we do currently accept patients into the office at this time.
Yeah, as healthcare workers, our main objective is to maintain the safety of our patients. One of the primary ways we do that is with masking. And as a healthcare facility in Maryland, patients are not necessarily required to wear masks, though it's highly recommended, and all clinicians and staff are wearing masks to protect the patients when they come in.
The difference in Delaware, however, patients are required to wear a mask in the state of Delaware.
We also do have sanitization procedures where we're sanitizing all the equipment after every single use. So if somebody touches something, we're wiping it.
Every employee and patient is screened at their time of arrival to the clinic. And those presenting any level of symptoms they are asked to leave the office and follow up with their physician prior to returning to the office. We do enforce, we strongly enforce social distancing practices within the office.
What happens if patients are unable to come into the clinic?
If a patient's unable to come into the clinic, we do offer the service of telerehabilitation. Patients are connected with our physical therapist or physical therapy clinician through a video chat on a HIPAA-protected platform.
We're able to provide a comprehensive physical therapy program incorporating corrective exercises, which can be performed with household items for 3 to 5 times a week.
And do patients say are they as satisfied with telerehab as they would be if they were coming in to see you guys?
Yeah, patients are typically satisfied with their care. There was a recent study done that actually showed patients undergoing telerehab were actually rating their therapeutic alliance, so the way they felt their provider was interacting with them, higher than the providers actually felt that they were interacting with their patients.
So let's say somebody's watching this and they're like, they're interested. What are maybe some of their frequently asked questions probably are, do I have to see my doctor? What if I'm unsure? What if I don't know if it'll help me? Does insurance cover it? What would you guys say to people who are kind of interested in starting out?
Well, to start with, do you need to see your doctor? So in Delaware and Maryland, we do offer direct access. There is direct access within the state. So direct access is your ability to seek evaluation and treatment from a physical therapist without a physical therapy prescription provided from a doctor.
We do recommend that you consult your insurance company regarding the direct access coverage, because insurance companies do vary and they may require a prescription from your doctor after about 30 days.
And so does insurance cover telerehab?
Telerehab sessions are billed the same as an in-clinic visit.
Yeah, some insurance companies have even elected to waive financial responsibility for the patient if they're being treated via telerehabilitation. But we encourage to call. If you have any questions, our therapists are more than happy to talk with you, answer any questions. In light of the COVID-19, we are offering complimentary consultations to any essential workers at this time.
And the beauty about these complimentary consultations is that we're able to do like a 20-30 minute assessment and we can kind of determine if it's a good choice for you.
Guys, thank you so much for taking the time to talk with us today, and thank you for what you do, and hopefully people can get, all the help they need.
Great. Thank you so much for the time.
All right. Kristen Phillips, Mark McDonald, thank you so much.
If you're interested in scheduling an appointment or have questions, we have Novacare Rehabilitation's contact information on delmarvalife.com.